Okay, for this week's video, we're going to be starting with kinesiotaping as the topic this week. We're starting with indications and contraindications, of course. The indications for kinesiotaping are for pain relief, for swelling and edema, for general circulation improvement, injury prevention, joint support, neuromuscular re-education, and performance enhancement. Don't use kinesiotape if you have any cuts or if you have any skin conditions, people with congestive heart failure or kidney disease, blood infections, cancers, things of that nature. We also don't want to use kinesiotaping. We don't want to influence the lymph or the blood flow in somebody that has a blood condition, DVTs included. So for patient preparation purposes, we want to make sure that you have not exercised or showered or bathed within the last hour before we apply the kinesiotape, just to keep the integrity of your skin intact and make sure that you're safe. We prepare the skin by making sure that the excess hair has been removed on a male, and that there is no any type of ointments or creams or anything like that. You want to wipe it dry and clean it off with an alcohol wipe. Once dry, begin the explanation to the patient. We want to be using K-tape for ankle stability in this particular example. So I have 3 strips of kinesiotape here that will go around his ankle. The ranges of motion and restriction should not be an issue. Kinesiotape is not like regular athletic tape. It's not for the purpose of restricting a range of motion of an ankle or a joint, but it should feel like it's stretched and it's supporting the joint. Also, whenever you go to take it off, I'll give you a couple more additional instructions on removing kinesiotape to keep from harming your skin. You should expect this to be sticking on you for 3 to 5 days. And while we're doing this, I'm going to have you go ahead and flex your ankle toward the ceiling like that, okay? So without further ado, we'll get started. I'll take my first piece of tape here. The tape strips that I have cut are probably not the right length. They're a little bit short, underestimated a little bit here, but I didn't have much left, so apologies for that. It doesn't look quite right. The most important thing about kinesiotaping is the amount of stretch that you use whenever you perform the placement. You always want the first inch or two and the last inch or two to be placed on with no stretch. And the medium or the middle range is going to vary depending on what area of the body we are talking about. So I am going to have you swivel over on the table. I'm going to have your head over here and your foot down here so we can have your foot in the camera. You don't have to lay down, just kind of sitting up like that. And if I could have you remove that sock for me. Okay, so the first piece of tape we're going to be starting, going lateral to medial, not stretching the first couple of inches. So I have a rip that I have made here. We will go ahead and take this off. We'll be starting on the lateral aspect of the ankle, starting right here and pressing firm, and we want to come around like this, peeling it off and sticking it like this so we can stretch it. We want a 50% stretch, a medium stretch, to come around this inside of the ankle. And sorry for the bad camera angle, but we're going superiorly up to the calf with a 50% stretch. And again, that last inch, we don't want any stretch at all. You want to lay that down. Press the tape in. Okay. All right, that's it for our first piece. Second piece, we're going to be going medial to lateral this time. So we're going to be taking a similar approach, going underneath the foot, starting on the inside medial aspect of the foot with no stretch at the very beginning. We want a 50% stretch of all but the last inch of the tape. And we want that to be coming up this way and no stretch for the last inch or so of the tape. The last piece is going to go around the back and then underneath the foot. It's going to be a little bit difficult to not get the tape on top of the other tape for this third strip, just because the ankle is not particularly big and the tape is wide at this point. Whenever you use multiple pieces, it gets a little bit difficult. So, explanation for the last piece. We want to start around the lateral aspect like this, the medial aspect rather. And you do want the lateral aspect. So we want to go here like this with no stretch. You can take the paper off. The majority of the way. We want a 50% stretch around the ankle. And then an 80% stretch back around this side. And ideally, as said before, this would be a longer piece that would come up to here. 80% stretch, making sure that this is all good. And piece down. Okay. You can go ahead and swivel back around here. Okay. Post-application. After the tape is applied, move your ankle around, making sure everything's feeling normal, feeling good. You don't have any movement restrictions, but it feels supported. Everything's comfortable, nothing is overstretched. Reminding the patient that feelings of uncomfortable skin pulling or catching are abnormal and to bring this up to the physician if it occurs. Remind the patient that the tape should come off in 3 to 5 days, and remind them of the instructions stated previously for how to remove the tape. So this is the part where I let you know how to remove the tape. So if you are going to remove the tape, what you're going to do is you don't want to just grab onto it and rip it at a 90-degree angle. What you want to do is kind of press the skin down and pull it straight down and work it as it goes down. Okay? Because if you pull it off, it's designed to stay on for 3 to 5 days. If you pull it off too quickly or you pull it off at the wrong angle, it could cause some skin irritations or potential little cuts. Okay? Perfect. Do you have any questions for me?
Nope.
All right. This concludes our video on kinesiotaping.